How to respond to consult in a hospital setting. Consult is a letter written by a health professional to another health professional inviting him to review a patient's medical history, assess the patient, and make recommendations for his or her treatment. In hospital setting, doctors are the most people that write consults to dietitians. How can you attend to this consult when it gets to your office? When the doctor brings in the consult in your office, get the consult register. Guide the doctor on how to register the consult in the consult register. After registering the consult, get the consult, read through the consult, try to understand everything written in that consult. You are free to Google any word that you do not understand in that consult. When you have understood the consult, take your word codes to the ward. When you arrive in the ward, move to the nursing session. Introduce yourself and the consult to the nurse. He or she will guide you on how to locate the patient bedside and the patient folder. When you have gotten the folder of this patient, do not move straight to the patient bedside. Read through the folder again to understand some other things that will help you while assessing this patient. For instance, this patient might be suffering from viral infection. You need to know this before getting to the patient bedside so that you will equip yourself. When you have finished going through this folder, you can then move to the patient bedside. Always address the patient by his or her name. If the consult says Mr. Chika, while getting to the patient bedside, call him Mr. Chika or Mrs. Chika Kodo. The patient will respond. This will help you to take your stand in assessing the patient, and it will also help the patient to relax and listen to you. When you have done this, introduce yourself to the patient. The patient might think that you are a medical doctor. Some of them have not seen a dietitian before. Let the patient know who you are. Introduce yourself that you are a dietitian, a food doctor, that his consultant has written to you to come and review him. Tell him that you will assess him, and this assessment will help you to manage him effectively. After that, proceed to Nutrition Care Process, NCP. Start from nutrition assessment. Even though that client history is the last in nutrition assessment, I advise you to start from the client history so that it will put your work in orderly form. Start from the client history, the presenting complaints or the chief complaint. What is this patient presented with? Which day was he or her presented? As a result of what? Is it diarrhea or frequent urination? After the chief complaint or presenting complaints, move to history of presenting complaints. What are the measures that these patients took at home before coming to the hospital for expert management? After the history of presenting complaints, you move to family social history of the patient. Family social history of the patient's occupation, his highest level of education, his religion, method of fecal disposal, source of drinking water, his housing, etc. After the family social history of this patient, you move to past medical history of this patient. Has this patient been admitted in the past? If yes, as a result of what? Is it as a result of the same illness that brought him to hospital or another? Does this patient have a family history of this present illness that he or she is suffering from? After the past medical history is the present medical history. The present medical history can be the chief complaint or the presenting complaint. It can still be past medical history. It can still be a new diagnosis that he or she is currently being managed for. After the present medical history, if it is a pediatric case, move to antenatal history of the mother. Remember that life starts immediately after conception. Move to antenatal history of the mother. After the antenatal history, you move to immunization history. After the immunization history, you move to developmental milestone of the child. After this, you move to anthropometry. Check the patient's weight, measure the height or the length, and calculate the patient's BMI. If this patient is a child, after checking his or her weight and the length, then also take his MOAC mid-upper arm circumference with your Shaka script. After that, compare your findings with the reference standard. Move to the next domain, biochemical data or biochemical tests and procedures. Open the patient folder. At the back of the inside folder, you will see the patient lab results. Copy it out in your jotter. After the biochemical data, you move to the next domain, nutrition-focused physical findings. We call it clinical assessment. What are you seeing on the patient? As you are looking at the patient, is this patient wasted? Are there any prominent rib cages? Is there any presence of edema? Is this patient in obvious respiratory distress? Is this patient dehydrated? Is he or she pale? Is there any presence of dermatosis? Is there any presence of fluffy hair? etc. Whatever you see, you put them down. After nutrition-focused physical findings, you move to food or nutrition-related history. In this domain, there are 8 subheadings that you need to cover in this domain. 1. Food and nutrient intake. Food and nutrient intake of this patient. You have to get the macronutrient intake, the micronutrient intake, the fluid and beverage intake, the total energy intake per day of this patient. Always remember, when you are making this assessment, get the frequency of consumption and quantity of consumption. The second subheading is food and nutrient administration. It can be enteral or parenteral nutrition. The third one is medication and complementary alternative medicine use. These include the medicine prescribed and over-the-counter medications taken by the patient, including herbal concoction intake. The fourth one is knowledge, belief, and attitude. That is the understanding of this patient as regards to this nutrition. The patient or client behavior in order to make sure that these intervention goals were achieved. What is his or her behavior? The sixth one is factors that affect food supply and food availability for this patient. The physical activity of this patient, that is the cognitive ability of this patient to be involved in physical tasks like food preparation, food consumption, feeding him or herself, nutrition-related patient or client-centered measures. That is, the perception of this patient in the nutrition intervention and the impact of that intervention to his health or to his life, and the nutrition quality of life of this client or patient. When you are done with this assessment, you now move to your nutrition diagnosis. From your assessment, what are your findings? Make use of your critical thinking. Make use of it and make your nutrition diagnosis, your correct nutrition diagnosis. Having made your nutrition diagnosis, you have to bear in mind your intervention goals, and you put down your nutrition interventions. Those interventions that can help you to achieve your intervention goals. Those interventions that can help you to manage that your nutrition diagnosis. You put them down in your nutrition intervention. I advise you to counsel your patient immediately. Educate him or her why he or she needs to adhere to this dietary management and counseling. Because some patients, while in the hospital bed, still live the same lifestyle they lived before coming to hospital. Those ones that are addicted to smoking, they will still smoke in the hospital bed. You may not know, but they will stealing it and smoking it. Even those ones that are addicted to alcohol, they do the same. That is why you need to counsel him, educate him why he should avoid all these things so that your management will be effective in him or her. Also, why you should not wait until the patient is discharged before your counseling and educating. Some of the patients will even leave the hospital without you knowing it. Some may sign against medical advice, might even decline dietary management. These are the reasons why you should not wait until this patient is discharged before counseling him or educating him. When you are done with this, you now document step by step based on how you assess this patient. And remember that after the clinical or the nutrition-focused physical findings, you bring in your vital signs before you proceed to the next domain, which is food or nutrition-related history. And do not forget to communicate to the people in food service for the food delivery.